Welcome to our education and health awareness on rheumatoid arthritis. I'm Gayla Lee Chambers with Sierra, a senior at the University of Omaha studying in psychology. This short informational training session, you will learn more about rheumatoid arthritis and how this diagnosis can affect your mental health.
So what is rheumatoid arthritis? Rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just your joints. In some people, the condition can damage a wide variety of body systems, including the skin, eyes, lungs, heart, and blood vessels. Types of rheumatoid arthritis include seropositive RA. If your blood tests positive for the presence of a protein called rheumatoid factor, it indicates that your body may be producing an immune reaction to your normal tissues. Seronegative RA. People who test negative for the presence of antibodies or RF in the blood are referred to as seronegative, but they can still have RA. Diagnosis cannot be just based on this test, as clinical symptoms, x-rays, and other laboratory tests will be taken into account. While there is no certainty of this, people who test RF negative are likely to have a milder form of RA than those who test positive. Overlapping conditions. Autoimmune diseases tend to display many common symptoms, making their diagnosis particularly difficult. And people who are diagnosed with one autoimmune disorder may eventually develop another. Symptoms for conditions like lupus, fibromyalgia, Lyme disease, chronic fatigue syndrome, neuropathy, sciatica, anemia, hypothyroidism, and depression have overlapping symptoms. RA may even be confused with osteoarthritis, which is not even an autoimmune disorder, but is caused by daily wear and tear of the joints. What are the symptoms? Tender, warm, swollen joints, joint stiffness that is usually worse in the mornings and after inactivity, fatigue, fever, and loss of appetite. Some other symptoms include about 40% of people who have rheumatoid arthritis also experience signs and symptoms that don't involve the joints. Areas that may be affected include skin, eyes, lung, heart, kidneys, salivary glands, nerve tissue, bone marrow, and blood vessels. Don't procrastinate. Seek medical advice from a doctor for these reasons. Pain, swelling, or stiffness in one or more joints, joints that are red or warm to the touch, joint tenderness or stiffness, difficulty moving a joint or doing daily activities, joint symptoms that cause you concern, joint symptoms that last 3 days or more, and several episodes of joint symptoms within a month. What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. How do you know if your medical condition is affecting your mental health? Rheumatoid arthritis can take a toll on your mental health. The disease is known for causing pain, stiff joints, and fatigue, but can also lead to depression. In fact, if you have RA, you're 2 to 4 times as likely to have depression as someone who doesn't have it. If your RA makes it hard to do the things you enjoy in life, you're even more likely to get depressed. It's a vicious cycle because depression can make RA pain and fatigue worse. It can even raise your odds of heart disease, which are already higher if you have RA. Where should you go for an assessment and/or evaluation? You can see your primary care physician, a licensed counselor, community health clinics, or your local hospital.
Our tip for the day: if you notice swelling in your joints, this could be a precondition for arthritis. This concludes our education and awareness topic on rheumatoid arthritis. I'm Gayla Chambers along with Sierra, and we hope this was helpful and that you have a great day.